Okay, so today we're going to be talking about a very exciting topic for me, and that's homeopathy. Because homeopathy really caused me to make a shift from being that traditional eye surgeon thinking that I could cut any eye disease or fix any eyeball by cutting it and putting it back together again. So when I developed my severe adult onset asthma and almost died twice, traditional Western medicine let me down. I could not get any help. All they did was put me on 3 medications. The medications had side effects, irritability, a tremor, and you can't be a good eye surgeon if you have a tremor. Then I had to take a beta blocker. Beta blocker kind of gets rid of the tremor, but that made my asthma worse, and that was my life. So I went to some of the top pulmonary doctors that I knew in the area, and they all told me the same thing. There was no cure for adult onset asthma. Take your medications. If you don't take your medications, you could die. Of course, I almost died twice even taking my medication. Shoveling snow in Pennsylvania is one good way of aggravating your asthma. So then I started to investigate alternative treatments, and I found homeopathy. And I know it wasn't a placebo effect, because I went to a homeopathic doctor, and they prescribed a homeopathic remedy, and it really didn't do anything, nothing. I went back again. The second remedy I got may have helped a little bit, but I really wasn't that impressed. But the third remedy, it was like somebody turned on the light. I mean, my asthma just left me. My mental and emotional attitude changed. And it was like a miracle. And interestingly, I still carried around my inhaler for about a year because, I thought the asthma would come back, and it never did. So I began to then look at homeopathy in the treatment of chronic eye disease. Because at that time, after you practice medicine, when you get out of medical school, you think you have all the answers, right? And then as you practice, you realize that there are many people that you're not helping, and in some cases, you're actually making them worse with your therapies. So I thought, well, maybe homeopathy could help some of these people that are doing well. Then I discovered in the early 1900s, the majority of ophthalmologists were homeopathic ophthalmologists. There's several homeopathic textbooks. They talked about different homeopathic remedies for different eye diseases, so that really intrigued me and then motivated me to get my degree in homeopathy. And at that time, one of the only places to get a homeopathic education was in San Francisco at the Hahnemann Homeopathic School. And it's interesting because I went to medical school at Hahnemann Medical School in Philadelphia. So I had to go to school twice now in San Francisco to study homeopathy. So I was living in Pennsylvania at the time, and every month for a long weekend, for 4 years, I flew to San Francisco, very intensive study weekend, then homework, and back the next month. And it just really fascinated me because now I was learning a system of medicine that actually had the potential to cure a disease. And it's rare in traditional medicine that doctors actually cure a disease unless they operate. And I can remember Dr. Rowan likes to give a talk. He holds up a $100 bill. He says, if you name me one drug that actually cures a disease, I'll give you this $100 bill. And you can't come up with anything. So the thing that really fascinated me about homeopathy is it's a completely different approach than traditional Western medicine. Homeopathy believes that the body has a wisdom, and you need to listen to the symptoms. And the symptoms are essential for the body to maintain homeostasis or balance. So if you believe that the body is made in the wisdom and likeness of God, and that it has an intelligence. Every time we get a symptom, it's because our body needs it. For example, if you get diarrhea, well, your body needs the diarrhea. Why? Maybe you ate some toxic food, you have a virus or intestinal flu, and you need the diarrhea to get rid of those toxins. Why? Because your body wants to get rid of those toxins in the form of diarrhea to help maintain balance or homeostasis. So the traditional doctor will say, oh, you got diarrhea, it's dangerous. Here's something that will cause you to become constipated. They give you something to slow the intestinal. Now the homeopathic doctor believes, okay, if the body has the wisdom, I'm going to give you something which causes diarrhea. Now you may think, Doc, are you nuts? I got diarrhea. You're giving me something to make it worse? But in actuality, you're helping the body do what it wants to do. So when I had my severe asthma, my asthma was cured by taking a homeopathic remedy that causes asthma. So one of the laws in homeopathy is called the law of similars. Like cures like. Now, even in traditional Western medicine, they use this law to a certain extent. For example, if you have a ragweed allergy and you go to the allergy specialist, what is he going to do? He's going to give you injections of ragweed. And you're going to say to him, Doc, are you nuts? I'm allergic to this stuff. Why are you giving it to me? Well, he's using the law of similars. Digitalis, or the foxglove, is a plant that if you take the plant in high doses, it will cause heart failure. Yet doctors use low dilutions of digitalis to treat heart failure. So this kind of a homeopathic approach, like cures like. Gold is very toxic, and it can cause rheumatoid arthritis, but yet at one time they were giving gold injections to treat rheumatoid arthritis. So this idea of like treating like. The other interesting thing about homeopathy, homeopathy is based on true science and true observation. When we use a homeopathic remedy, the homeopathic remedy is conducted in a proving. So we look at all the symptoms that any particular remedy or substance will cause. Now, in traditional medicine, they have a drug, like for high blood pressure, and that drug may have all sorts of side effects. In homeopathy, there's no such thing as side effects. It's the drug has that particular action. So, for example, all the homeopathic remedies are studied in the following way. It's called a proving. So let's say all of us in this room are going to prove belladonna. So we would all be given a dilution of belladonna, and we would take it every day, and we would have a diary, and we record all of our symptoms. And at the end of that period of time, would come together and collect these symptoms, and that would be the proving symptoms. And in homeopathy, for every homeopathic remedy, there is a textbook written, thousands of pages about all the possible symptoms. So there are some symptoms that are characteristic with everybody. Let's say everybody in this room that took belladonna got a throbbing headache. So that would be a characteristic symptom. Maybe others would get redness in their face or a fever. So those would be characteristic symptoms. Then what the homeopathic doctor does when somebody comes to the office with complaints, and let's say they had a throbbing headache, redness of their face, and a fever, they'd look it up in the directory of symptoms and go, oh, that's belladonna. Then they would give them belladonna. So this idea of the law of similars, like curing like. And that's the main law and the main difference between homeopathy and traditional Western medicine. So all of you are coming with eye problems, and we are looking for homeopathic remedies that may cause that particular problem with your eye. And these have been studied for the last 200 years in terms of matching those symptoms. Now, homeopathy, in addition to looking at your physical symptoms, your eye problem, and other physical problems like maybe high blood pressure, diarrhea, indigestion, also looks at the mental and emotional state, because that is a critical part of the homeopathic evaluation. So we put all these symptoms together, and then we come up with a particular homeopathic treatment. Now, to give you an example, one of the most interesting cases I had, a medical doctor came to me who suddenly went blind in his left eye. He was a radiologist from University of Tulane. He was lecturing in Pittsburgh. Went suddenly blind in his left eye. Went to the retinal specialist at the university there, and he had a central retinal artery occlusion, which is a stroke in the eye. And we were taught in medical school, you get a stroke in the eye, there's not much you can do to reverse it. And typically you want to worry about protecting the other eye by putting the person on blood thinner, something like that. So I saw him a week after he had this stroke to his eye, and he was an Indian doctor, and in India, they're very, very big advocates of homeopathy. In fact, there's a joke. If you throw a stone anywhere in India into a crowd, you'll hit 3 homeopathic doctors. There's so many homeopathic doctors in India. They're on every corner, and it's a big form of medicine. So he came to me and wanted to know if I could treat his blind eye. And I said, well, Dr. Datta, I don't have any experience in treating this, but let's take your homeopathic case and see what we can do. So in homeopathy, we always want to look for 2 things we want to look for. What is peculiar in that situation, and also causative factors. So when you come back and I do my homeopathic evaluation with you, I'm trying to find out what is peculiar about your eye problem, and also causative factors. Stress, something changes in your life that may be related to that. So I'm talking to Dr. Datta, and I find out that he's an interesting guy because he likes to argue. He told me, I like to argue, Dr. Kondrat. He said, even though I know I'm wrong, I'll keep on arguing until I'll wear the other person down and he'll give up. And that was, to me, was pretty peculiar. And so then we were talking a little bit more, and I says, well, right around the time you lost the vision in your eye, what was going on? Anything unusual happen? And he said, I lost an argument to my wife. Now, an ophthalmologist would say, that has nothing to do about the case, right? Nothing at all. But as a homeopathic doctor, that was everything. That was everything. So I prescribed a homeopathic remedy that was related to an occlusion, a blockage of an artery, which there are many, but then an unusual feature of liking to argue, and then also maybe the anger or the indignation that he lost an argument to his wife. So I gave Dr. Datta the homeopathic remedy, and he was flying back to Tulane, and I said, well, give me a call in about a week, and we'll see if the remedy had any effect. I may want to change it and see what happens. So I talked with him a week later. He says, wonderful remedy, Dr. Kondrat, wonderful remedy. He said, 3 days after I took the remedy, my vision started to come back. He said, now perfect. Good job, doctor, good job. And he said to me, you act like you're surprised. Don't you believe in homeopathy? And it kind of changed me. So no matter what the condition is, if you understand the cause, homeopathy can reverse it. Another interesting case, I was treating an engineer with glaucoma. Now, you know the engineer types. I'm glad there's no engineers in this room. You're not an engineer, are you? But, he had the narrow black tie, the glasses, the Nassau haircut, pocket protector. He'd come in every visit with his notebook. Time he took the glaucoma drops, time I took the pressure, how many hours of sleep he had, what he ate that day, you know, and graphing the pressure and studying everything, trying to, you know, figure out his glaucoma. And he wasn't doing well. He was on 3 glaucoma drops. His pressure was really high. And I said, Mr. Smith, would you consider homeopathy? You know, you're not doing well, and we're going to have to do surgery to lower the pressure. And he asked me a lot of questions about homeopathy, and I took his homeopathic case, and I gave him a remedy. And I said, let's let this remedy act in your body. Come back in a month or so. I'll recheck your pressure. Hopefully it'll be lower. I said, don't change your eye drops. Just continue everything. So he came back into the office, and all the girls in the office would say, I didn't recognize Mr. Smith. I didn't even know. He's so different. So I went into the exam room, and he has a sweater on. His hair's a little longer. Doesn't have his pocket protector, no tie, doesn't have his notebook. So I walk up to him and go, hi, Mr. Smith, good to see you again. I said, have you noticed any changes since you took the homeopathic remedy? He said, nope, nothing at all. Didn't do a damn thing for me. I says, well, what about, where's your notebook? Well, just didn't think I needed any more, and you know, you have a different outfit on. Well, I just, you know. So sometimes the change in homeopathy, the person isn't even aware of it. Because there's something about a philosophy of disease. In Western medicine, we feel that disease comes from outside of us. We blame it externally. You know, this happened to me because of this. You know, we're blaming it outside of us. In homeopathy, we believe that disease comes inside of us. So, as you think, as you believe, you are. So if we can change that subtle belief inside of you, you know, your external environment changes. I always like doing a homeopathic follow-up with the men, because usually men are not more aware of like their feelings and things like that. Because I remember I talked with this one guy, in 1 month I want to talk to all of you to see how you're doing. And I can remember talking to this guy. He said, well, I haven't really noticed much difference, but my wife isn't irritating me as much. See what I mean? It's like you don't change, people outside of you change. So homeopathy is really, really fascinating. And some of my most astonishing cures have occurred with homeopathy. But the only problem with homeopathy, it is very, very difficult. It's not like you treat 100 people with homeopathy and all of them will need to write the same remedy. You don't treat the disease. You treat the person in the disease. So let's say all of you have glaucoma. You look around the room. Everybody is different. You're sitting differently. You're holding your hands differently. You're all different. So homeopathy focuses on the person, not the disease. And it's important that after you begin taking your homeopathic remedy, you kind of observe changes. There may be some changes in your body that you may feel are insignificant, but for me, very significant. Let's say, for example, a couple weeks after you take the remedy, you develop a wart on your finger. You may think, well, it's nothing that would have happened. No, it could be related to the homeopathic remedy. We usually like to see a change in the mental, emotional state first, then the physical. Let me give you an example. Let's say you get the homeopathic remedy and I talk to you in a month. You go, oh, Dr. Kondrat, wonderful remedy. My vision is perfect now. I can't believe how clear it is. But I can't sleep at night. I'm really irritated. Things are bothering me. That's a bad remedy. Because we would rather have you say, I don't know what you gave me, Dr. Kondrat, but I'm calmer, I'm sleeping better, I have a better appetite, but I'm not sure it really helped my vision. I'd rather hear that than the other way around, because there's a certain hierarchy in healing. We want to heal the mental and emotional first because that's the cause of your vision problem. We don't want to go the other way. There's something called suppression. We want the body to heal in a natural manner. The other thing, and you may not be too happy to hear this, because the body heals from inside outward, getting a skin rash is a good sign. I was taught when I studied homeopathy, if you give a remedy and they develop a rash, that's a reason to celebrate. So if you do develop a rash, eczema, psoriasis, you have a sinus problem with a lot of discharge, or you get diarrhea, that's a good sign because the body heals from inside outward. And we want to see those things coming out. So whatever you do, if you do develop a rash, don't put steroids on it or some cream to push it back in, because that could maybe reverse the whole process of homeopathy. Also, because we're looking at subtle changes with your body, I don't want you to do anything different than what you're normally doing. So when I talk to you in a month, I'm going to say, how are you? Any changes? How's your energy? How's your mood? How's your vision? I don't want to hear, well, I went to a new acupuncturist and he gave me 30 treatments, or I started taking Prozac, or something else. And whatever you're doing now, don't make any changes. So if you're getting, weekly chiropractic adjustments on your back, continue it. If you're getting acupuncture treatments, continue it. If you're, going to massage, continue it. Just don't do anything new, because that could interfere with the homeopathic remedy.